How are you?
I'm good, good.
Uh-huh. Hi, how are you?
I'm good, good.
Uh-huh.
This is for vaccinations, eh?
Yeah, this is just for the people who do not have national identity cards
Oh,
or
okay.
any documents. So we are assisting them to give them, any, letters to ascertain that they're residents in the constituency. Yeah.
Okay, so is that for the vaccination?
So this is for vaccination. Do you have your ID with you?
What I was gonna ask
Uh-huh.
is if you're over 60,
Uh-huh.
do we have to wait?
Yeah. No. You just go straight.
No,
Yeah.
I need to bring my husband. That's why.
Okay, that's fine. So if
Otherwise,
you're
if
above
he
60.
if he doesn't know, we're both above 60.
Oh, yeah.
I just color my hair.
No, that's fine. You just come and
So I can bring him tomorrow morning and
yeah, and just come straight to you just go by the tent there. So you just tell them you're
Just
over
tell them over
60.
60.
Yeah, that's fine.
they just said he won't do it
Uh-huh.
unless I come.
Okay, that's fine. It's all right. Hanzishi? No, Mira Tenzwe. Hi, sister. Moshe, what's the issue? Okay. Hanzi ari kuchema, ari kuti hanzi matikana asina chitupa abaiwe. Haanotombobvira atora. She wasn't issued any national ID. Ava ndo vari in charge. Handiti so enda unobaiwa handiti usacheme because also the problem is because I think she's overwhelmed because she was telling me a personal story because she hakuna hama dzababa tete
uyu manje nyaya yachona it's a long story akatorwa ari mudiki vakambomutora kudhinga kusvika zvakanetsa
so vada kuvaccinate
saka nda kuvaccinate
saka makore mangani Sharon 18
turning 19 in October.
Okay, hi, how are you? First dose, yeah. So here they're just doing first dose. And so today we are at Meborane Satellite Clinic in Ward 16. As you know that Harare West has 2 wards, that is Ward 16 where we are today, and also Ward 41. So the reason why we are here at Meborane Satellite Clinic is to assess the process of COVID-19 vaccination. That's number 1. Number 2 is also to hear the complaints that are being raised by the residents, as well as also to commend the staff here at Meborane Clinic. So the other issue is also to assist those residents without national identity documents. So you find out that the process of vaccination, they require you to have your national identity document. So we have find out that there are a lot of residents who do not have national ID cards. So we are here as a member of parliament and together with Councillor Denford Ngadziore of the 2018 elected councillor for Ward 16, we are issuing out letters to assist those residents who want to be vaccinated but do not have national identity documents. So this process, we started it after the government, through the permanent secretary of the Ministry of Health and Childcare, issued out a statement that as members of parliament, as councillors, headmen, and so forth, they have a mandate to write a letter for the residents, in their communities, so that they can be assisted in terms of vaccination. So you might want to know, why they want national identity documents. It's for the simple reason, they want to add, the people who are being vaccinated here to the national demographics, that is to the national statistics. So this is the reason why would also want your national ID. And also the fact that if there are any reactions with the vaccine, or something like that, we are able to follow up with the residents who have been vaccinated here at Meborane. So we started this process yesterday. We were in Maubra with Councillor Kudzai Kadzombe. It's Ward 41, who is the 2018 elected councillor there. So we were there doing the same process, assessing the COVID-19 vaccination, as well as issuing out letters to those residents who do not have access to their national identity cards. So basically, this is the process why we are here. And we have received an overwhelming response from the residents. There's so much overwhelming response. You find out that a lot of young people do not have their national identity cards for different reasons. Some, their parents have divorced, they have separated, so they're failing to get their national identity documents. And also you have other people who have had their IDs being stolen, or they have lost their IDs. So those are the people that we are helping, so that at least they can get vaccinated, so that they protect themselves and also the people that they're living with, in their homes. So that's the purpose we are here for today. Yeah, so basically when someone comes and they need assistance, they need this letter. So what we do is we take information from the resident. We want a proof of residence, from the person who wants, who wants a letter. So basically we just take their name, their address, their ID number. That is if they have been issued before. But if they've never been issued, that's still okay. Then also we just ask questions. That is if they've been issued an ID before, or if their national identity document is lost or stolen or destroyed, something like that. Then also just the date. So this is basically, just a form where an individual fills in. Then after that, I can then give them this letter, which just confirms that the resident has expressed an intention to benefit from the COVID-19 vaccination rollout program. So this is the letter that they would then produce to the nurses who are doing the vaccination process. So basically that's how we are just doing the process. Very easy, very simple. They can just bring their proof of residence that they are our residents in Harare West Constituency. That's it. I also want to commend the staff here at Meborain Clinic, as well as at Marlborough Clinic, where we were yesterday. The amazing work that they are doing. I think most of them, they're even working, overtime. They're also even skipping lunch breaks and breakfast, so that they can assist, the residents who are waiting to be vaccinated. So I just want to commend, the amazing work that they're doing here at Meborain Clinic. So you find out that here at Meborain, we have 3 nurses who are doing the actual vaccination process. So 3, it means, per day, they are taking maybe plus or minus 100 residents for vaccination, which is a good number. It's a fair number, considering that there is a national lockdown and they have to finish their work at 3. So I think they're doing an amazing work, and they're assisting. And also the elderly, they're being given preference when they come in. The elderly are assisted so that they go. And also people living with disabilities, I think they're doing amazing work. They're also assisting them so that they don't wait for long, or they don't join the queues. So this is the work that they're doing to Meborain Clinic. Make sure everyone at home gets vaccinated, and just continue wearing your mask and sanitizing and social distancing. And it can. All right, guys, see you. All right, thank you as well.
But apa zvitupa izvi tinosvika nazvo na 3. Tosvika nazvo na apa tinoita
Unovhara nguwai?
tovhara na 3.
All right.
Chipako chakarambuka. Unoona izvi sasa zvaitwa izvi. Zvimwe zvakaungana apa izvi.
Muretsa pavanotogara vatonyora.
Munhu ari panze kana tora chitupa chake oenda pabhuku iro.
All right.
Apo ndo panopedzera nguva i1, they are 2.
All right.
Panopedzera nguva yese apa. Izvi zvakanaka sezvo.
So anenge achibaya anenge ari apa i1 anobaya.
Anobaya ana masa.
Pakufila in my details. Kochi chinotora time. Anti munhu anenge ane ID yake kungokopa.
Zvakawandisa zvinofilwa in zvaizvo. Toda kuti serial number dzekadhi dziri kubva uko.
Dzekadhi.
Vanhu vacho vanenge vasingapinduri futi nekurumidza ka.
Saka paunofila in zvese is okay.
Hapana vanhu vanopedza panouraya zvinhu zvese.
All right. Ndo panononotsa the process. So it means apa ndo panoda kana maybe vanhu 2. Mabhuku 2. All right. But have you tried maybe to recommend kuti pange pane mabhuku 2? All right. No, it's fine.
But if papa ndo pane nyaya sister vananga na pressure. apa hapana pressure futi apa
apa kungotora
izvi nditori kumberi iye ari kumasure
alright
uye ari kumasure nditori kumberi steering
okay alright tazviona
vanofira basi tosvika na3 nazvezvi apana vanhu vari kufira nyaya yese
saka panoda 2 mabhuku apo kapo panoda 2 mabhuku
iri bhuku 1 rima 1
handiti
because akabva panapa kaya panapa anogara siku anenge akatogara inde ndakatogarawo because nditori kumberi kudhara matozva nditori kumberi kungoyo zvangu kuti ndabva kuti asi handina chekuita nekuti ndinonyorerei zvangu
pasati kubhuku risati ranyorwa
yatozara kare
hai basi
vari kuyamusa vari kubaya It's okay.
Thank you. Welcome. All right, sister. Thank you. But we really appreciate the work you are doing. Tinotenda nebasa guru. Uku. Yeah. So nyaya yo ye clerical work. Yeah. Okay.
Saka vasina zvitupa vanenge vachigarira mari na3 toita kuzoda kuti
vasati vatorerwa zvitupa
ndokuti vasina zvitupa vasati vatorerwa zvitupa vanoona zvese hasa zvaitwa izvi kuzoenda apa
okay
na wanti tienda kulunch iko zvezvine mazuva ano ese kubva panakatanga kuitika handisina lunch ndokuti tisina kuvapedza mwoyo unorwadza futi kuti
timusiye vanhu
tisina kupedza topedza na3 tida kuzoita futi chi oda kuzoita mastatistics
Okay, all right, thank you. Thank you so much. I'll talk to the sister in charge to know how can we make sure to speed up process. I'll talk to her to know tingagadzirise sei ipapo. At least pakaita vanhu 2 vari kunyora mubhuku zvinogona kuita sei zvinogona kubatsira. Handiti? No, it's okay, sister. Handitya? Kuve bhuku wacharoenda pa wasatadzoka kuti all right. Musare musina munhu. All right. No, it's fine. It's fine. Just know that us as your MP, the councillors, we appreciate your work. Just try to assist them. Try to assist them. Because you know what? The problem is, we are 4 a.m., 5 a.m. Because yes, Harare West. So yakakura. And we only have 2 centers, Marlborough and Neighboring. You see, Warren Park, Warren Park constituency. So when you go to Warren Park can go there. And it's just like Varuna Tino, they can go to desert. And so you find with Munanga ku vaccinate from constituents market Okona. Then Munuya Anomukira 4-5 a.m. Anenga panap. So it means Pavano Zoya. So I'll just talk to the sister in church to put this paperwork. Chokwanisa kui itotive quick how. To at least about 3 per day. Bakawand. Handitka.
Apana rumenda kulunch tatobva kutida zvatovhara toita kuti ngoshanda vanhu ivavo tipedze na3 tingeta vapedza kuti tavatora zvitupa kuzovadzosera manje hazviiti.
But are you also guys here vaccinated, my workers? But yeah, most of my casualties are COVID. Because like yesterday, Marlborough, we saw vaccinated, but yesterday somebody tested positive. Even at the staff, because we're having problem with staff, it will be positive.
Pressure tinoita ndekuti handitsinotora vanhu 80 but tine mainsensha vanonzi anouya sitovhara rinouya okay inouya havanenge vasipo pa8 apo
machembere hapo pa8
vachembere zvokuti totokuwa machembere kunokucha machinja timaitozvita namaubu vaverengwe mu8 was like izvozvo tinasisisu machembere databaya 22 saka tatova ma100 chakadaro tatsoenda totora makadzi
kune staff kune staff yekanzuro yapinda
vanenge vasiri mu8
vafana neavo famasi yebhutisi yakatomborambirwa but nhasi yatoyanetsa
alright
amunoona sateta kuti tikati staff toti staff toti kuzivananzi
ma residents
but tinovatsanangoti
batosvika mu177
Alright.
Because of that. Like it's one we Butisa for vakagara. Odabai.
Butisa chiri muno constituency.
Iri Westgate.
Oh, yeku Westgate. Yeah.
My essential services.
Muno.
Sana Mebori in 24 hours.
Yeah.
Ana Butisi vava
okay.
Ana okay. Ana bone mash. Ana pick and pay.
Yeah.
Takatingo to since Takagatsan.
No, it's okay. No, it's alright.
But plus per date no book kana 3 companies.
Okay. Alright.
But no that the muno change.
Auntie also. Anyway, thank you. So it's also we appreciate the work you're doing. We do appreciate. We know the crisis that you might be facing as well, you know. Seva Shandio.
I think the problem so yeah. Some them rights also good.
Yeah.
So to name. But no was very one constitution.
Yeah, medu. It's okay, sakachivura ivangotiona kuti chakubuda muno mende vanhu vakuvhurirwa.
I think I'm going to batsira kutoudza vasa.
Handiti.
Endai hapana zvakazara mukati.
Hey.
Imwe challenge atina the shortage of staff. Inini ndini ndiri kubaya kuno.
Yeah, ndanzwa na sister in charge. Ndanzwa noita uchibaya kuno kubaya vana.
Saka ndoita zvese. Saka unenge uri pa pressure yekuti ukabaya baya.
So we'll be just coming. Tinchiona kuti vari vasina zvitupa vai vanechida kunyorera tsamba. Tinchi every day. Zvatanga chingoita pesa.
I know that's fine. I appreciate that because zvinonetsa ne system ye.
Yeah, papa.
All right.
No, it's all right.
All right. Thank you so much.
Aiwa, thank you. Totenda imene basa renyu. Tupa will not be able to vaccinate because the other thing is outside the 80, they also take people from companies essential services. For example, the pharmacists, things like that. Vaccinate constituents. So that's the problem. Could you find the number is 80? You're not gonna quick sija. You end up maybe 120, 130. So she was now saying, to be honest, you see, and even they have 3 hours from here. From now. Could you 3 hours? Could 3 o'clock so they are saying they are actually pleading with me mimi also munzwisise they will not be able vaccinate so they'll just stick kune vanhu vatorera zvitupa. So I don't know how we can balance this. We need to solve this together. Imimi muchinzwawo crisis irimo yekuti mune munhu mumwe chete ari kubaya. You see, how do we balance? So sister in charge vandikumbira kuti chiendai munotaurawo nemaresidents because vanhu vanozotanga kupopota panapa poita crisis, the other time pakatozoya police vanhu vakunetsa kuti we want to get vaccinated. So tichida kuti zvinhu zvive peaceful and also zvive respectful kuti how do we solve this issue. Yes, so ngokasumudza roko.
What if they write my name Evan Matori with you right now?
That's a good idea. Is there somebody else with a suggestion? Hanzi varuya vacho vasatorwa ma-IDs vonyorwa pasi mazita then ndo vanotangwa nawo. That is if makurumidza kuuya mune makuya makuseni and so that hamuchauye na 12 o'clock iwo stara kuwakanyoresa nezuro anditi. So I think this is a good idea and it can actually work because kana munhu atosvika panapa anditi. Yeah, I think that's it. So let me just go jotaura now, then we do that. Anditka, it's fair. Anditi. Yeah, so they'll just start from ivo vachotanga panapa ndio vanenge vakutangwa mangwana. Okay, that's fine. So let me go and talk to her ndinzwe kuti zvakamira sei. Yes, you wanted to say something? And it's kunzwa? Okay, here they open at 8. Yes, but of course other people will be here as early as 5 a.m., 4 a.m. because only got kure. And so this is the challenge. Our constituency is quite big. And it's as far as Tinwald North kuya kuno kumeborain. So mun anotomukira makusen. So imimi also try to be early so that you can be helped. And it's mukwanisa ku assist. So we'll do what we've agreed, then I'll negotiate na sister. And it's
how about queue and then vasika so that there's no.
Yeah, so let me just talk to her and Dinsgwe also because she knows and she has experience yepanapa ekuti zvinofamba sei. Because the only kuti wauya wakanyorwa nezuro anditi wakanyorwa nezuro na 12 o'clock mumwe munhu auya na 4 a.m. so techida kuti ndivo vane experience, so we would want to know kuti pasazoite confusion and pasazoitwe makakatana. So we don't want that. So I'm just going back there, then I'll tell you kuti okay, how do we proceed? Anditi? Yeah. So anyone else? Apachisina anditi? All right, thanks. Is it every day?
Positive.
All right.
Saka tinowapedzera 1 hour. Tebwe ichazosumudza.
Hans is foul.
Sisifaa muri kuti kwakuno. Vazvizita mandizha tisaka ngojera kwadaidza ne.
Sisfoul. Sisfoul, hey. Nesisfoul. Hanzina chef. Inzwe munzwe ndimi ma chef edu. All right, so yeah, right. So pani nanti manje uthi ndinovaudza kuti no apachisina. I went there. So they were saying good, okay, since tatouya, can we get our names then written so that mangwana patinouya tozikana tovhatazikana. So can they just write their names then maybe it's raised proper?
This is chef Magondo varipo. Vangani
They're about 20.
Hey, vakawandisa.
Vakawandisa
won't manage there.
Yeah.
Sister in charge maybe do not sister boss Magona, she's the one on the vari.
Don't go to buy a kunongo.
Avabai. Chef Avabai.
So what does he? There's a crisis here tonight.
Tungeta for fumigate na and matika fumigate togara 1 hour.
Homni makukachidza mukati umu.
Emanzanzi munongotoona.
Zvituvazvo zvobva zvanzi. Name todi. Tautomirira munhu tonyora munhu achitosvika.
Ai, saya.
Nezimwe here?
Sorry, get one thing here say yeah. It's
they are not promising.
Yeah, they're not
like
promising.
Like it's 13:04.
Yeah, and we're not changing the
farm. That's a balance now.
That's a balance. Okay, that's fine. It's okay. Yeah. So the issue is they are saying meet a social distance because so they are saying mangwana makusen 4 a.m. munasvika imi mune list renyu rearea makuchitaiwa yakanyorwa nezuro uyauya na 4 a.m. How are you going to do that? So that we don't want hondo. So vangoti munhu ngaangoza kuti mangwana kuya earlier. Yeah. So because ari kuti ndinodhila sei mangwana munhu auya 4 a.m. and nemunhu ari kutaura kuti ndakanyorwa nezuro. So hanzi ndo patinotanga kuti kwatakunzi aiwa mukuita uori because they won't believe kuti vanhu vakanyorwa list ava ndevane zuro.
Greetings Zimbabwe Daily family and welcome to our platform where we try to bring you news, information and activities as they are happening. Today we are in Melbourne where we are following events at the Melbourne Satellite Clinic and observing as the vaccination process is taking place. A lot of information is out there in the public domain discouraging and encouraging people to get vaccinated. It is a choice that you have to make whether you get vaccinated or not, but the overall goal is that we want to be healthier as a nation, and we can only achieve this when we can achieve herd immunity. So we are at Melbourne Satellite Clinic observing the vaccination process. We've also made contact with Harare West Member of Parliament, Honorable Joana Mamombe, and Councillor Denford Ngadziore and Councillor Kudzai Kadzombe as they monitor the activities happening right here in Ward 16. They are issuing letters so that their residents who don't have national identity documents can get vaccinated at the clinic, because it's a requirement when you go for vaccination that you carry your national identity documents. But for those that don't have, either the documents have been stolen, or they could not, or they have not yet accessed them, or they have just not been able to replace the documentation. This is the process that is taking place here in Harare West and in all the constituencies around the country. So if you want to get vaccinated and you don't have your national identity documents, do approach your community leadership. the councillors, the MPs, the headmen, the chiefs, and they can give you letters verifying that indeed you're residents of those areas and indeed you are a citizen of our country and you want to get vaccinated. Thank you so much for joining us on Zimbabwe Daily. Keep tuned in and let us keep Zimbabwe going.